Hello, everyone. Thank you so much for joining us today. And I know you've heard it, but again, congratulations on getting accepted here to the Massachusetts College of Pharmacy and Health Sciences. There are a lot of great reasons for why you initially looked at us and why you'd like to attend. But what we're going through today is something that is really important to you specifically in trying to make sure that we're a fit with all those different pieces, not just with regard to the really great accolades that come with our school and the reputation we've built over many years of hard work, but also because you want to make sure that we're a fit for you. You want to make sure that we have the type of faculty that you want to learn from and the type of student body you want to be a part of. So today what we're going to do is look specifically at our health psychology program, speak with one of our faculty members and one of our students, and you guys can get that much more information. So really take the time to listen to them today. My name is Luke Wilson. I'm one of our admission counselors here within the Massachusetts College of Pharmacy and Health Sciences. So anyone that's watching from the North Shore, Massachusetts, the Cape and Islands in Massachusetts, anywhere in Maine, because I cover that whole state, and anywhere in the southeastern Massachusetts, I think follow the coast from the Carolinas all the way down around to Louisiana. I've probably spoken with you already, so here I am in the flesh. And I've been working in higher ed for nearly a decade. So again, always feel free to reach out to me. But enough about me. I want you guys to get to know our faculty and our student today. Dr. Spencer, feel free, take it from here and introduce yourself.
Hi, my name is Stacy Spencer. I'm a professor of psychology. That means I teach courses in psychology. I'm also the director of the health psychology program. I've been at MCPHS for almost 20 years now, hard to believe. My background is in social and personality psychology with an emphasis on the applications to health. I'm going to pass it on to my student, Arlie.
Hi, everyone. My name is Arlie Cisneros. I'm a fourth-year health psychology major, and it's been an awesome, awesome experience. I'm going to pass it on back to Luke.
Thank you, Arlie. Thank you, Professor Spencer, so much. Now, Professor Spencer, I'm going to start off the questions with you here. Would you mind describing the strengths of our health psychology program and why it's the best choice for students that are looking at us and that are currently in the program?
Sure. So like most psychology programs, we provide a foundation in concepts in psychology, from intro to psych, abnormal psychology, human development, biological psychology, but we have a special twist where we also have a lot of health-specific psychology courses, such as the course called Health Psychology. We have stress and illness, drugs and behavior, death and dying, and all of that rests on the foundation of research methods. So we have a really strong research methods course that students take. I think what makes MCPHS special for students is if you really do have an interest in health, what you get by being at MCPHS is you're not just in classes with psych majors. Almost every course you take is going to be with students who are also interested in health, but maybe pursuing different professional pathways. And there's one other thing I want to add about our program that's really unique is we have this career seminar series. So every year of the program, students are exploring their interests, making sure they're ready if they know exactly what they want to do, and helping them figure out the best fit if they're not quite sure what they want to do. So all that's built in to the curriculum.
Wonderful. Thank you so much. Now, Arlie, this next question is for you, and it's pretty simple. Just why did you end up picking us?
So I originally became extremely interested in MCPHS at the acceptance student dinner that was held here in New York. I met a former student, and the way she described life at MCPHS made me really want to be a part of it. It just seemed so welcoming and fun. And you know, when you're going into college, transitioning from one state to another, from high school to college, it's really challenging. So being in an environment that's welcoming was something that I felt I really needed. And then I came to an open house after that dinner. And as soon as I saw the campus, I hadn't even gotten out of the car yet. And I knew that I needed to come to this school. The environment that MCPHS is in is just so beautiful. It's so safe. Everything is right there. And I absolutely loved it. It's so modern too, which I felt is really important in education now.
Wonderful. Thank you so much, Arlie. Professor Spencer, I'm going to pass it back to you here. Similar question, a little bit different. What do you enjoy most about teaching here at MCPHS?
So I have taught at other schools prior to coming to MCPHS. And one of the things that I love, well, there's two. One is the students. The students come with this really great enthusiasm. They're really interested in a variety of things, and that's always fun. But also my colleagues, the faculty are teaching focused. And people talk a lot about this. There are colleges and universities where the teachers are the professors who have the expertise, and other colleges and universities, the faculty may be more involved in research and do a little less teaching. My colleagues are in the classroom, but they all have a passion for teaching. So we're always talking to each other about ways that we can teach better, examples we can bring into our classes, and even how we can teach together. So I can give you a good example. We talk a lot about interprofessional education because that's really important for healthcare. We want future healthcare providers to be able to work in teams with people who represent different health professions. So I have the good fortune of teaching an IPE course with Lori Nugent, who's the program director for MRI. So what we do is we work on the issue of patient distress in MRI by bringing the health psych majors together with the MRI students. And it's a really great opportunity that I wouldn't have if I taught at pretty much any other university. So we have lots of interesting opportunities like that. So it's fun for me. But I guess I want to wrap it up by saying, my answer up with saying that when you walk the halls of MCPHS, students are talking with faculty. We stop in the hall, we have conversations, and I love that atmosphere. We're really in it together, and I've had students stop me in the hall. I haven't had them for a couple of years. I have students who are emailing me a couple of years after they graduate, even if they weren't in my program. So all of that, I think, speaks to the community that we have at MCPHS.
That's really great to hear, Professor Spencer. Now, I'm going to go back to you, Arlie. Do you mind sharing some examples of how the health psychology program has prepared you for your career in healthcare, and a little bit about your plans for after you graduate?
Okay, the program at MCP has prepared me in so many ways. I mean, for starters, we could talk about the education. You get phenomenal education. And I mean, if you don't really know what you want to do yet, for example, you could take classes such as mind-body medicine and lifestyle medicine, which is more on the holistic take of medicine and lifestyle changes without having to necessarily take medication. And then you can take classes that are more about the clinical view of healthcare, and that would be, social psych, abnormal psych, classes like that. So you really get to learn a little bit about everything, and that helps you kind of figure out where you want to be or what you want to do in your future. And then aside from that, the lifestyle and the courses that you take in general at MCPHS definitely help you prepare and develop a lot of skills that are essential, especially working in healthcare. And for example, I'll give you an example of that. When I first started at MCPHS, I hated presenting. It was my biggest fear. And, that was the worst thing that I could think of. But through taking from my first semester at MCPHS, you kind of have to get used to presenting, and you kind of have to force yourself into it. And then once you start getting into biostatistics, all the research classes like Dr. Spencer had mentioned before, it becomes normal. You have to really practice what you're going to say. You really have to test yourself. And I think with that, you end up building, your communication skills, your team working capabilities, your responsibility skills, and all of that.
Wonderful. And just one follow-up to that for you, Arlie. Has all of those experiences sort of helped you towards putting together some plans for after you graduate?
Yes. So I'm actually starting at LIU Post this fall semester, 2021. I'm going into the Masters of Social Work program with a concentration in child and family welfare.
Wonderful. Congratulations. Excellent. Professor Spencer, I'm going to pass it back to you now here. Would you mind providing some examples of accomplishments and appointments and accolades from you and your faculty that you've received over the years within the program?
Sure, great. So the faculty in the health psych program have been recognized for their teaching excellence, winning awards from the university, but also being recognized outside of the university as being excellent teachers. They publish research in really well-known and prestigious journals and present at conferences that are highly recognized and regarded in the world of psychology. So that's great. On campus, we have a faculty member who's responsible for organizing what we call the Schwartz Educational Rounds. And so, provides that great service to the community in bringing topics to the discussion, where you have students and faculty from every program talking about something related to health and healthcare. For example, one year the topic was, or one semester the topic was the use of humor, and students came from their own clinical experiences to talk about when it worked out well and maybe when it didn't go so well. So, the faculty are involved in lots of different things and really are accomplished in all of those areas.
Excellent. Thank you so much, Professor Spencer. Arlie, I'm going to come back to you now. You touched on a lot of different in-class experiences that have helped you. Would you mind going outside the classroom, though, and talk about some different activities you've done to help with your professional development while you were here?
Yes, so I've done a lot of volunteering. I've been volunteering on this app called Be My Eyes for the past 2 years. You help those that are visually impaired. They give you a call, and then you help them pick out what they're looking for. I also worked at the Forsyth Dental Hygiene Clinic, which is in the Boston campus, for about a semester. I worked at the front desk. That was awesome because you got to work with the hygienist, you got to work with the patients and learn new softwares and learn how to confirm appointments and all of that stuff that you would do in the real world. So it was really fun. And then aside from that, last spring semester, I started working on creating a club called Project Earth Club. I was actually able to start it up last semester, and I'm the vice president of that. And then more volunteer work that I've done, I actually did Bikes Not Bombs. I was volunteering there because of an assignment that I had to do for the seminar class that Dr. Spencer had mentioned before. We only had to go twice, but I loved it so much I ended up going every Thursday until COVID happened, and then they had to temporarily shut that down. And then recently, I was introduced to a website, also an app called 7 Cups. I was introduced to that by also Dr. Spencer. And it's been amazing. It's pretty much an app where you're a listener. So you can pick a chat, and then people go in and they tell you about their challenges or what they're going through. And it just feels awesome being able to, even though you don't know them, being able to help them and let them know that there are people that care about them. So that's been a lot of fun. And then before COVID, I was supposed to start volunteering at Boston Children's Hospital. I was going to be working in the ICU unit with the child life specialist, but a week before I was supposed to go in, COVID happened, and that was also closed.
Oh boy, I hope you have time to sleep and all that. That's a lot you've been doing. Wonderful. Thanks so much, Arlie. Now, Dr. Spencer, I'm going to come back to you here. Would you mind discussing any additional tracks or other opportunities within the health psychology program that students should be considering if they're seriously considering attending here?
Sure. So we have the traditional 4-year health psychology degree, and then we also have a pre-medical track within the program. So the students who are interested in going to medical school can take the courses they need to prepare for the MCAT and are typically required of medical schools. We also have 2 accelerated pathways that includes the occupational therapy pathway and physical therapy pathway. So students in those pathways spend 3 years on the Boston campus, and then they move on to the OT or the PT program, depending on which they've been pursuing. And we have a lot of students in all those categories. We have the traditional 4-year students, we have students interested in pre-med, and we have a lot of OT and PT students. But they all come together and kind of share their experiences and their interests, and sometimes they convince others to pursue what they're interested in, things they may not have considered before.
That's really great to hear about all those different opportunities that are presented for students. So I really like it because I like to tell students, it's tough to know exactly what you want to do when you're 18. It's good to look at programs that have a lot of different avenues for you to explore. So that's all wonderful information. Arlie, I'm going to come back to you here, and this is the last question for you. Really basic, but it's always easier said than done. What kind of advice would you offer prospective students that are watching this right now?
Okay, so I would definitely say, don't be scared to ask for help. because I know as first-year college students or transfer students, life can get very challenging and stressful, and it's extremely easy to become overwhelmed. But as I had mentioned before, and like Dr. Spencer mentioned before, MCPHS is very welcoming and very understanding. We're all here for the same thing. A lot of the professors and the faculty members have experienced the things that we are currently experiencing. And if you go to any of them and you ask just to sit down and talk to them or for them to give you advice, I can guarantee you that they will all be more than happy to help you with anything. That is something I wish I would have known my first and second year, because I spent a lot of time like stressed out of my mind. But now that I know that, use it to your advantage. Use it to your advantage. It helps so much.
Excellent, thank you. And I'd also echo that right now. You can also ask your admission counselor and student financial services counselors. We're all here to sort of help you through that process. It's one of the nice things about being, you know, a medium to small college is you get to build those personal relationships really easily. So ask me questions too. I don't mind. I'm going to ask one final question over to Dr. Spencer here. Would you mind sharing some examples of student outcomes from previous years in the program?
Sure. I think the problem is we don't want this recording to go on for hours and hours. I'm very proud of the accomplishments of my students. And I'd like to say they go in a lot of different directions, which, going back to the career seminar course that we have throughout the curriculum, students are able to figure out what that best fit is, and it doesn't have to be in psychology and it doesn't have to be in healthcare. We do have students who pursue a very traditional path in health psychology. They go on and get doctoral degrees in clinical health psychology. We have students who choose other clinical directions. Arlie's a great example of someone who's interested in being a therapist and working in that role, but is going to do so through social work. I've had a lot of students do that. Some of them stay within health, and other ones will provide that expertise and that skill set in other areas outside of health. I think if I were to pick one example of what would be the most surprising direction that a student has gone in, it's architecture. And through the career seminar series, I discovered that this student had a real passion for building and suggested that he take courses at Mass College of Art and Design, which is right across the street, part of the Colleges of the Fenway. He also took courses at Harvard, and he got involved as a volunteer with an organization that helps kids K through 12 see what design is really about. He's in architecture school now. And I said, well, you know, how do you feel about going to MCPHS and getting a health psych degree, but you're going on to architecture? And he said, it's phenomenal, because his goal is to design healthy spaces, healthy workspaces, healthy living spaces. And he knows he can take what he learned from the program and now apply it to architecture. So I'm really excited about that example to give to you.
Wonderful. That's all really great information. So to Dr. Spencer's point, we don't want to take up all your time. We know you have other things to do, and Zoom fatigue is real. So we'll wrap up there. Thank you so much for you guys joining us today. And really, again, congratulations. And again, to Arlie and Dr. Spencer's points, keep asking questions as they come along here. And we're here to help. So thank you, and have yourself a wonderful day. Bye-bye.